Sleep disorders occur at all ages, but the elderly tend to have a higher risk. In addition to taking medication, herbal remedies for insomnia have long been widely used to treat symptoms of sleep disorders. Herbal remedies for insomnia in the elderly help calm the nerves, reduce stress, promote good sleep, and almost never cause side effects. Causes of insomnia in the elderly. Insomnia is a common sleep disorder characterized by the inability to sleep at night and a constant state of fatigue, irritability, and mental exhaustion. It is currently estimated that about 10% to 30% of adults suffer from insomnia, and among them are individuals aged 60 and older. They are more prone to insomnia because sleep quality gradually declines with age. The elderly tend to sleep less and are easily awakened after initially falling asleep. Some studies show that starting in middle age, a person loses an average of 27 minutes of sleep each night with each passing decade. This decline in sleep quality and duration is associated with the body's internal timing system. Below are the causes of insomnia in the elderly, including due to aging. As people age, body functions gradually deteriorate, including the nervous system, leading to difficulty falling asleep and poor quality sleep. At the same time, a decrease in melatonin secretion, a hormone that regulates the sleep-wake cycle, also contributes to changes in biological rhythms, making it easier for the elderly to wake up early and harder to fall back asleep as usual. Due to medical conditions, the elderly often suffer from various health problems such as cardiovascular, respiratory, and digestive issues, which significantly affect health and alter sleep patterns, leading to nighttime insomnia. Additionally, neurological impacts, dementia, Parkinson's, Alzheimer's, mood disorders, anxiety, depression, and bodily pain, arthritis, joint degeneration, also make the elderly uncomfortable and less likely to sleep deeply. Due to lifestyle habits, impacts from daily routines, such as frequent daytime napping, drinking excessive coffee, tea, alcohol before bedtime, can also seriously cause insomnia. Other factors, such as using electronic devices, lack of physical activity, and an uncomfortable sleeping environment, noisy, overly bright lighting, also prevent the elderly from sleeping adequately and deeply as desired. Due to medication use, older adults tend to use more medications to treat illnesses and improve their conditions. The combination of different medications can cause side effects and significantly reduce sleep quality. Furthermore, certain medications may have side effects such as insomnia, for example, diuretics and antidepressants. Due to psychological factors, depression is a common cause of sleep problems at all ages. Typically, elderly individuals may experience feelings of loneliness and sadness when they lack care or someone to confide in. This can gradually lead to stress, anxiety, and emotional sensitivity, resulting in sleep disturbances. Harms of insomnia in the elderly. Sleep is truly important for human health. Therefore, if insomnia persists frequently in the elderly, it directly affects their quality of life, alters daily routines, and leads to the development of many serious illnesses. Below are some of the harms of insomnia in the elderly, including decline in physical health. Insomnia significantly weakens the immune system in the elderly, increasing their risk of diseases such as cardiovascular issues, high blood pressure, diabetes, and obesity. Moreover, their bodies are constantly in a state of fatigue, sluggishness, and low energy due to poor sleep quality. Decline in mental health. Normally, the sleep cycle should last from 6 to 8 hours per day, but for the elderly, they tend to wake up at night due to sensitivity to surrounding noises. This causes their mood to become irritable, easily stressed, and may lead to symptoms of depression and anxiety. In addition, their ability to concentrate diminishes, memory declines, and they often forget what they've done. Impact on quality of life. Difficulty sleeping causes the elderly to lose rest time, disrupts their sleep cycle, and makes them sleep more during the day. It also makes it harder for them to participate in social activities, thus affecting their quality of life. Increased risk of accidents. Fatigue due to insomnia makes elderly people more likely to have accidents while traveling or doing household chores. Mechanism of action of herbal remedies for insomnia in the elderly. Below are the mechanisms of action of herbal remedies for insomnia in the elderly. Sedative effect, nervous system relaxation. Herbs like lotus seed heart, chamomile, and passion flower have calming effects, helping to ease tension and anxiety and making it easier to fall asleep. Active compounds in these herbs act on the central nervous system to reduce excitement, creating a sense of relaxation and promoting sleep. Increased melatonin production. Melatonin is a hormone that regulates the sleep cycle. The human body needs this hormone to enhance sleep quality and sleep more deeply. Users should consider some herbs, such as valerian. Improved blood circulation. Certain herbs, such as ginkgo biloba, help improve blood circulation to the brain, which reduces cerebral ischemia, thereby promoting easier and deeper sleep. Reduction of discomfort symptoms. Natural herbs like ginger and lemon balm help alleviate uncomfortable symptoms such as bloating and indigestion, preventing the elderly from being startled awake at night. Listing herbal remedies for insomnia in the elderly. Elderly individuals should consider and use the following herbal remedies for insomnia. 1. Passion flower. Passion flower, Passiflora incarnata, is a climbing plant with purple or white flowers. It has traditionally been used in herbal medicine to treat various ailments, including insomnia, anxiety, and stress. This herb is commonly found in North America and is cultivated in Africa, Asia, Europe, and Australia. Studies have shown that people with anxiety disorders can use passion flower to treat their condition as it is as effective as oxazepam, Cerix, in alleviating similar symptoms. Additionally, this plant contains flavonoids that relax the nervous system, reduce stress, and improve sleep quality in the elderly. 2. Chrysanthemum. Chrysanthemum indicum, is a popular flower widely used daily. According to traditional medicine, this herb has a bitter taste, helps reduce inflammation, muscle spasms, and acts as a sedative, reducing stress and significantly improving sleep quality when used correctly. Research has found that flavonoids in chrysanthemum can promote relaxation, enhance cognitive ability, and make users sleepier. When flavonoids bind to benzodiazepine receptors in the brain, this natural herb induces sleep more quickly and relaxes the entire body. You can brew it into tea and drink it in the morning, but avoid overconsumption at night. Chrysanthemum can reduce the increase of plasma ACTH, adrenocorticotropic hormone, produced by the pituitary gland due to stress. This helps the elderly avoid psychological changes and unnecessary irritability. 3. Coral tree leaves. Coral tree leaves, Erythrina variegata L., are a wild plant commonly found in Vietnam. In traditional medicine, various parts of the coral tree are used for sedation, reducing fever, and treating asthma and epilepsy. Furthermore, extracts from this herb can help alleviate anxiety, depression, and insomnia in the elderly. When used, it tastes quite bitter and astringent with a neutral nature, and can be combined with other ingredients like rock sugar or honey to soften the taste. 4. Lotus embryo. The lotus embryo is the sprout inside the lotus seed and is a common herbal remedy for elderly insomnia found in Eastern and traditional Vietnamese medicine. According to traditional medicine, it has a cold nature, bitter taste, and enters the heart meridian, offering sedative effects. Modern science confirms that lotus embryo contains alkaloids such as nociferine, leucine, and nolumbin, which act on the central nervous system to promote better sleep. Prolonged use can lead to drug tolerance, so the elderly should only use it as prescribed by a practitioner. 5. Noto ginseng flower buds. Noto ginseng flower buds, Panax noto ginseng, are a valuable herbal remedy used in traditional medicine. The main active ingredient is saponin Panax noto ginseng, PNS, which has antidepressant properties, reduces anxiety, and calms the nervous system. It helps the elderly sleep better when brewed into tea. Additionally, these buds can be used in cooking, such as stewing with bones, to enhance nutritional value and regulate sleep. 6. Schisandra. Schisandra sinensis Bale, is known in Eastern medicine as a precious herb that treats many ailments. It has calming effects, treats stomach pain, nourishes the kidneys, prevents insomnia, and addresses various health issues. CO2 extracts from Schisandra enhance sleep and memory, making it highly beneficial for the elderly. The recommended dosage is 4g, 8g to boost health. Avoid overuse, which can cause serious complications. 7. Eucommia bark. Eucommia bark, Eucommia almoides, is a traditional Eastern medicine herb used to treat insomnia, back pain, knee fatigue, and physical weakness. It has a warm nature, nourishes the liver and kidneys, and can lower high blood pressure in the elderly. It contains pinoresinol diglycoside, which effectively and durably reduces blood pressure. To use: boil a moderate amount of Eucommia in water, take 1 dose per day, and consume regularly to alleviate insomnia. 8. Stephania root. Stephania root, Stephania rotundalauer, is considered a medicinal herb for chronic insomnia in the elderly. It calms the nerves and stabilizes the nervous system. The compound rotundin in this root helps lower blood pressure and significantly increases concentration. 9. Longan-aril. Longan-aril is the flesh inside the longan fruit, which is used in cooking and can be made into sweet soups. It is also a remedy for various conditions, including insomnia. Traditional medicine believes that insomnia in the elderly may stem from gastrointestinal imbalances. Longan-aril is used to nourish liver-ine and cool the body. Eating a few pieces before bed can calm the mind and promote relaxation. 10. Valerian. Valerian is a commonly used herbal medicine for treating insomnia in the elderly. It contains organic acids like benzoic, salicylic, and caffeic acids, and 5 to 10% inorganic compounds, such as glucosides and sucrose, to address health issues. This herb promotes deep, uninterrupted sleep. It also alleviates anxiety and fatigue and helps with muscle problems like cramps and pain. 11. Ginseng. Ginseng has been used for centuries in traditional Chinese medicine, offering numerous health benefits and improving chronic insomnia in older adults. Clinical studies suggest ginseng provides high nutritional value, boosts appetite, enhances brain function, and reduces fatigue and stress. It significantly improves sleep quality in the elderly, reduces nighttime wakefulness, and calms the mind. The recommended dosage is 1-2g/day. Start with a low dose and gradually increase. It can be brewed as tea, decocted, or chewed. 12. Reishi mushroom. Reishi mushroom, Ganoderma lucidum, is an ancient Asian medicinal herb for treating insomnia in seniors. It contains high levels of nutrients and germanium, 8 times more than ginseng, which regulates the central nervous system and shortens the time to fall asleep. Other active ingredients include ganoderic acid, adenosine, and polysaccharides, which nourish the body, enhance immunity, and improve focus. This herb can be consumed as tea or ground into powder to help maintain a stable biological rhythm in the elderly. 13. Ziziphus jujube seed. Also known as sour jujube seed, it enhances immunity, reduces blood fat, improves sleep, and relieves pain. When dried, it has a sweet, neutral taste that helps reduce stress and anxiety. Daily dosage ranges from 6g, 15g. It can be prepared by boiling, simmering, roasting, or combining with other ingredients to increase its effectiveness in improving sleep. 14. Polygala root. Polygala root, also known as yuan-ji or milkwort root, has a bitter, spicy, and warm nature in Eastern medicine. It nourishes the heart, calms the mind, reduces swelling, and treats insomnia. As people age, their sleep quality declines. Using decocted or infused polygala root water can significantly improve this issue. 15. Ginkgo biloba. Ginkgo biloba is a natural extract from the dried green leaves of the ginkgo tree. Native to China, herbal products with ginkgo extract have been used to fight chronic inflammation-related diseases like heart disease, stroke, and rheumatoid arthritis. Ginkgo is rich in antioxidants called flavonoids and terpenoids, which combat free radicals. It also has anti-inflammatory effects, improves blood circulation, stimulates the brain, enhances memory, increases focus, and promotes better sleep in the elderly. Furthermore, it significantly reduces stress and depression. For best results, seniors should take ginkgo biloba 30 minutes before bedtime to induce sleep more quickly. 16. Blueberry. Scientific studies have shown that blueberries effectively combat free radicals, the main cause of insomnia, migraines, and dementia in the elderly. Valuable bioactive compounds like anthocyanin and pterostilbene in blueberries protect neurons and brain blood vessels, neutralize free radicals, and improve memory. As a result, the risk of Alzheimer's and Parkinson's diseases can be significantly reduced when using products containing these compounds. Precautions when using herbal remedies for insomnia in the elderly. During the process of using herbal remedies for treating insomnia in the elderly, you should take note of the following important issues. Consult a doctor. Always consult a doctor before using any type of herbal remedy, especially for the elderly, since they may have various health conditions and may already be on multiple medications. The doctor will assess the health status and current medications to choose the appropriate and safe herbal remedy. Identify the cause of insomnia. Insomnia can stem from various causes, such as stress, anxiety, vitamin deficiency, or other underlying medical conditions. The patient needs to accurately identify the cause to apply the proper treatment. Dosage. Use the correct dosage of herbal medicine as directed by a doctor or pharmacist. Do not increase the dosage on your own, as it may lead to side effects. Duration of use. Herbal remedies should be used for a short period, about 2 to 4 weeks, and monitored for effectiveness. If no improvement is seen or side effects occur, discontinue use and consult a doctor. Drug interactions. Some herbs may interact with other medications the elderly are taking. Inform your doctor or pharmacist about all the medications being used to avoid potential dangerous complications. Purchase reputable herbal products. Buy herbal products from reputable herbal stores to ensure quality. Proper storage. Store herbal remedies in a dry, cool place, tightly sealed, and avoid direct sunlight. Monitor health. Monitor health conditions regularly after using herbal remedies and inform the doctor if there are any changes. Other measures to improve insomnia in the elderly. In addition to using herbal remedies, some home remedies can be applied to improve insomnia in older adults. 1. Psychological therapies. Cognitive behavioral therapy, CBT, helps patients recognize and change negative thoughts and behaviors that affect sleep. Relaxation therapy helps reduce stress, anxiety, and improve sleep. Tips for improving bedtime habits in the elderly. 2. Improve the bedroom environment. Boost natural melatonin. Artificial light at night can block the body's production of melatonin, a hormone that regulates sleep cycles. Supplementing melatonin can improve sleep in some individuals. Therefore, consider using low-watt bulbs near the sleeping area to help relax the body. Avoid electronic devices before bed. Blue light from devices such as phones, iPads, and computers can strain your eyes, cause stress, and disrupt your sleep. Ensure a comfortable bed. Try new pillows and mattresses with soft and comfortable materials. These benefit both the upper and lower body, help reduce sleep apnea, and alleviate back pain as you age. Quiet, dark, and cool bedroom. As people age, they become more sensitive to noise, light, and temperature. To avoid being startled at night, you can wear earplugs, turn off all sound-emitting devices. Use air conditioning and set it to a suitable temperature to keep the room cool. 3. Maintain a consistent sleep routine. Establish a regular sleep schedule. Go to bed and wake up at the same time every day, including weekends. Avoid excessive napping. Napping too much can cause insomnia and difficulty falling asleep at night. It's best to reduce nap time to under 30 minutes, enough to boost alertness and prevent fatigue. Go to bed earlier. Adjust your bedtime according to your desired sleep schedule, even if it means sleeping earlier than before. Limit the use of sleep aids. Many sleep aids have side effects and are not meant for long-term use. Sleeping pills cannot fully resolve the root causes of insomnia in the elderly, and overuse may worsen health and exacerbate insomnia. 4. Change eating and exercise habits to improve sleep. Exercise regularly. Exercise improves overall health and makes it easier to sleep. Activities such as swimming, cycling, and jogging should be maintained at a consistent and moderate frequency. However, the elderly should avoid exercising too close to bedtime. Limit stimulants. Avoid coffee, alcohol, and cigarettes before bed, as they disrupt sleep and harm internal organs. Avoid overeating or drinking too much before bed. Do not eat heavily within 90 minutes before bed. And limit water intake to reduce nighttime trips to the bathroom. Cut down on sugary foods. Establish a healthy diet for the elderly by avoiding foods high in sugar, which can lead to diabetes. Eating lots of sugar and refined carbs like bread, white rice, pasta, and chips can cause nighttime alertness and prevent deep, restorative sleep. Regarding the use of herbal remedies for insomnia in the elderly. 1. What form of herbal remedy should be used? Since natural herbs can be collected from plant parts, such as stems, leaves, flowers, and fruits, users can use them in either dried or fresh form, depending on the characteristics of each type. Additionally, for longer storage, it is recommended to dry the herbs and grind them into powder for tea or medicine. 2. How long does it take for herbal remedies to be effective? According to research, the effectiveness of herbal remedies for insomnia in the elderly depends on several factors. Type of herb. Some herbs are more effective than others. Severity of insomnia. Mild insomnia may show improvement after a few days or weeks of use. Severe insomnia may require a few months of usage to see results. Individual constitution. Some people may respond better to herbs than others. In general, herbal remedies should be used for at least 2 to 4 weeks to allow the body to adjust and help the mind become more relaxed and ready for sleep. If there is no improvement after 4 weeks, discontinue use and consult a doctor. 3. What are the possible side effects of herbal remedies? Although herbal remedies for insomnia in the elderly are natural, overdosing can cause side effects such as allergic reactions. Some people may be allergic to certain herbs. Symptoms include itching, swelling, shortness of breath, stomach pain, diarrhea, nausea, dizziness, and headache. Drug interactions. Some herbs may interact with other medications being taken. Drug interactions may reduce medication effectiveness, fail to improve insomnia, and worsen overall health. 4. Can herbs be combined with other medications? Combining herbs with other medications carries potential risks and should be carefully considered. Here are some important things to note. For point 1, risk of interactions. Some herbs can interact with medications, reducing their effectiveness or causing dangerous side effects. The level of interaction can vary depending on the herb, the drug, dosage, and individual differences. Examples of dangerous interactions. St. John's wort can reduce the effectiveness of birth control pills, antidepressants, anticonvulsants, and other medications. Ginseng can increase the effects of blood thinners, leading to a higher risk of bleeding. Ginger can increase the effects of blood pressure-lowering drugs to improve sleep, reduce stress, and relieve fatigue. Using herbal remedies for insomnia in the elderly is a safe and effective approach. Users should first assess their health status, then seek out herbal treatments based on traditional folk remedies. This can help calm the mind, improve sleep quality every night, and keep the body full of vitality.